Hi everyone, welcome. I'm Yasmin Firouzman, registered dietitian. I'm going to go over today the basics for success after bariatric surgery, and then I will answer questions once Dr. Watson finishes his lecture. Okay, so let's begin. The most common reasons for weight gain after bariatric surgery are often going back to your preoperative eating habits and lack of exercise, and for many patients, it's due to to changes in operative anatomy, which will require a workup, which Dr. Watson will discuss with you in a little bit. Okay. So the basics after surgery, healthy choices. There's about 5 of them. I'm going to go over each one. There's healthy choices, mindful eating, keeping a journal, exercise, and regular intake of your vitamins are all 5 basics that will lead to success. So number 1 being healthy choices. But when it comes to healthy choices, you really want to focus on eating frequently. That means eating every 2 to 3 hours after bariatric surgery. I can't emphasize how important that is for everyone. It prevents you from feeling, hungry to the point where you end up overeating at the following meal. If you're to go 4 to 5 hours without eating something, by the time it's time for you to have your next meal, you're likely to overeat because you're so hungry. So keep that in mind. You definitely want to eat every 2 to 3 hours. It helps prevent you from overeating at the next meal. It helps stabilize your blood sugar levels, which also helps with your energy level throughout the day. And it helps your metabolism. Waiting too long, your body will end up using muscle for energy, and that slows down your metabolism. So keep all that in mind. Goal after surgery is that everyone should consume about 12 to 1,500 calories a day, and everyone should have about anywhere from 60 to 100 grams of protein a day. And the calculation for that is 1.2 to 1.5 grams of protein per kilogram of ideal body weight. Now that calculation is a little bit hard to figure out, but I can help you with that after class if you want. I'll be in the back and I can answer that question for each one of you. Also, when it comes to your meals, you really want to focus on eating your protein first. You want to eat your protein first because it's going to offer you your nutrients. It's going to offer your body the protein that it requires. And then you want to have your vegetables. And then, but before I get to vegetables, let me cover that. Protein, foods that are high in protein are all your poultry, all your beef, your nuts, your nut butters, and a lot of dairy products are all very high in protein. And whenever it comes to choosing something that's high in protein, make sure that it has at least 7 grams of protein per total serving. Okay, that's for your protein. So once you have your protein, then you want to eat vegetables. And then after vegetables, you can have a little bit of complex carbs. You can still have carbohydrates after surgery because in reality, this operation is for the rest of your life. So you want to be able to have everything in moderation. But there are 2 types of carbohydrates. There are simple carbohydrates and complex carbohydrates. You want to focus on consuming complex carbs. They're higher in fiber and provide your body with a lot more vitamins and minerals. So they will keep you full longer than having a simple carb. Some samples of complex carbs are quinoa, oatmeal, barley, 100% whole grain bread, and brown rice. Those are all considered complex carbohydrates. And always, after surgery, as a rule of thumb, avoid items that have 10 grams of sugar or more. Okay. So this is a sample menu that bariatric patients should follow after surgery. This one is about 1,200 calories and has about 80 grams of protein. So as you see, I've spaced it out where you will have 3 meals and 3 snacks. So you'd be eating every 2 to 3 hours. And the portions are rather small in size, but it's frequent eating. And again, you always want to eat your protein first, and then the vegetables, and then your complex carbohydrate if there's room. So staying hydrated, very important after surgery. For those of you, with a show of hands, does anybody drink 8 ounces of 0-calorie beverages a day? Okay, so a good amount, good. You really want to focus on 64 ounces a day, and that could, your protein shakes would count towards the 64 ounces. Herbal tea would count towards 64 ounces. Crystal Light would count. So 64 ounces a day. And when it comes to beverages after surgery, all of you must remember that you should stop drinking 15 minutes before a meal and no drinking until 30 minutes after a meal. That's a rule of thumb for post-bariatric surgery. Okay, drinking with meals may lead to a more rapid transition of solids from the gastric pouch. Therefore, it may increase your ability to consume more foods. So definitely work on that if you've forgotten about this rule. Alcohol, high in calories, provides you 0 nutrients. Please limit or avoid after surgery if you've gone back to that. And sip your beverages, no straws. When you use a straw, you ingest a lot of air. So it can be very painful, and you consume more than what your stomach wants you to have. So you really want to go back to sipping your liquids if you strayed from that, and avoid carbonated beverages after surgery. A lot of air, a lot of bubbles. So stay hydrated. And if you're someone after surgery, a lot of people don't like the taste of water by itself. So experiment with that. Try flavoring your water naturally with cut fruits, cut strawberries, cut orange, cut cucumber. Or some patients will tell me, I can't tolerate this brand of bottled water, but I do just fine with something else. So experiment with different brands until you find that you can tolerate after surgery. Mindful eating, something very important for those of you who have had surgery. You really want to work on being aware of your psychological versus physical hunger. There is a difference. Psychological hunger is hunger due to sadness, boredom, happiness. And people tend to focus on psychological hunger late at night when you're home alone. You've had a long day of work, and you just want to sit there and grab something and munch. And if you pay attention, you'll notice that most times you're going to crave something sweet or salty. That's when you know it's psychological hunger. Because if you're physically hungry, your body will crave a wholesome meal. So just be aware of that next time you're sitting home by yourself, or having a good time with your friends, and you just feel like you want to snack on something. Okay? So another thing when it comes to mindful eating that's very important for those of you who have had surgery and the people who have not, you really always want to eat slowly. If you're the first person to finish your plate, most likely you're eating too fast. And there have been various studies that have been done to show that patients who eat slowly compared to patients who eat quickly consume less calories. So if you're a fast eater, chances are you're consuming more than what your body needs. So you really want to start paying attention to how quickly you're eating and work on that. Some other benefits, to eating slowly. One is that your brain, it takes your stomach 20 minutes to tell your brain, hey, I'm full. I've had enough. So if you're finishing your meal in 5-10 minutes, you're not allowing enough time for that to happen. So by the time you figure out, oh my gosh, I'm full, it's too late. You've had too much to eat. It also will help you feel satisfied when you take the time to taste every bite, to smell every smell of your meal, to taste, to feel the textures of the food in your mouth. You end up feeling a lot more satisfied once you're done with the meal. And then you'd be surprised. By eating slowly, you may begin to identify foods that you actually don't care for, but have never realized because you eat it so quickly. You're not paying attention to whether or not you even like it. It's just on your plate. You feel like you need to finish what's on there. But if you take the time to eat it slowly, you'll realize, I've never liked grapes before. So just try to pay attention to that. Also, it helps improve digestion. Digestion starts in the mouth. So by chewing your food well, you're giving your stomach a little bit of a break. It can also help you save money. If you go to a restaurant, you eat slowly, you're more likely to have leftovers, which can last you the following day. So it's a good way to save some money. So some simple tips to help you eat slowly. When you're eating your meal or your snack, take a bite, put food or utensils down between bites, and don't pick it up again until you've swallowed what's in your mouth. Turn TV off while eating. If you're watching TV and eating, you're eating mindlessly. You're not paying attention to what's going in your mouth, what's going in your stomach. By the time you're done eating, you look at your plate, you're like, wow, I ate all that, but you're not aware because you're watching your show. So just for a good 20-30 minutes, let it just be you and the meal. Eat at the dining table, not at the kitchen table. Not out of the box, not out of the container. Pre-portion your meals and try to eat at the dining table. And very important when it comes to eating slowly, chew your food. You want it to be chewed down to a mushy consistency. Just think baby food. So you can do that one of two ways. You can either count each chew. You want it to be 20 to 30 times that you chew your food, or just pay attention to the consistency. Once you feel like it's mushy enough, it's blended enough, then you could go ahead and swallow that bite. And always stop halfway between your meals and ask yourself, am I full? Do I need to finish the rest of the food that's on my plate? Because many of you have probably grown up and told that you can't leave the table until your plate has been cleaned. Anyone grow up that way with that mentality? Okay, a lot of us have. And it doesn't have to be. You don't have to clean your plate. So halfway through, ask yourself, do I need another bite? Am I still hungry? Am I still full? Am I full? Just assess your hunger level halfway through your meal. Some more tips to help you eat slowly. Try listening to music to help you relax. Remember that you don't have to eat everything on your plate like I just discussed. And avoid waiting more than 4 hours between meals. That will cause you to become so hungry that you're going to eat your meal very quickly and eat more than you need to. And, try using your non-dominant hand. If you're right-handed, try eating with your left hand, or try using chopsticks. That will help you slow down. And always, always listen to your body. You want to get in tune with your body. Your body has a signal that tells you, hey, I'm full. Listen to that and stop once you feel full. Not when you're so full you feel uncomfortable, have to loosen your clothes. Indications of fullness after surgery vary from person to person, but majority of you may feel pressure right below your rib cage, nausea, or pain in your shoulder or upper chest area. So just be aware of that and begin listening to that signal if you get that. And journal. Keeping a journal is very, very beneficial. In the 6 years that I've worked with bariatric patients, those who keep a journal are oftentimes the most successful patients, because it helps you keep track of what you're eating. Sometimes we eat more than we think we do, and we're not aware. But by keeping a journal, you're keeping yourself accountable. And you don't have to track your calories if you don't want to, but you should track, what you ate, how you felt after, the amount of beverages you ate that day, any goals you have for yourself, write on there how long it took you to eat the food, just whatever your personal goals are. And you could share your journal with a dietitian if you see one, with your doctor if you see one, or with a support group system if you have one, or just keep it for yourself as a way to monitor and hold yourself accountable. Anyone here use a journal? Okay, so you could use a journal by buying a notepad, just write, or you can go on your cell phone. There's many cell phone apps. Many cell phone apps, find the one that you like. A lot of them are free, and use that for maintenance. Exercise. Does anyone here exercise? Okay, good. That's about half of you. That's wonderful. Lack of exercise, again, big reason patients regain their weight after surgery. Goal, everyone should exercise at least, this is the minimum, 3 to 5 times a week for at least 30 to 60 minutes. This doesn't mean you have to go to the gym. It doesn't mean you have to hire a personal trainer. It could be anything as simple as walking. If you have back pain, joint pain, hip pain, something that prevents you from walking, or you can't walk more than 10 minutes at a time, then try walking 10 minutes, but do it 2 to 3 times a day. Whatever you can do. If you have any kind of pain in your lower body and can only use your upper body, try doing chair exercises and just emphasize on your arms and chest and waist. And some simple steps to becoming more active is, take the stairs if you can instead of the elevator. Look for the furthest parking space and walk that space. Put some music on and dance around the house. Contact your local recreation center, see if there's any classes offered. Anything you can do to help you to get more exercise in and become a little bit more physically active is great. The weather's going to get hot soon, so swimming is a great way. You don't feel the excess body weight. It's just a good way to get some exercise in. Vitamins. Anyone here taking a multivitamin? Good. Everyone taking a B complex? Good. What about calcium? Good. I'm impressed. Good. So everyone after surgery, whether you've had the sleeve gastrectomy or the Roux-en-Y, you are at risk for becoming deficient. So everyone should be taking vitamins after surgery, and I'll go over exactly what all of you should be taking. But they are required for the rest of your life. And if you don't take them, you may become deficient. And when you're deficient, some side effects could be lack of energy. And that alone can prevent you from exercising, can prevent you from taking the time to make a good meal, and taking care of yourself. So there's a lot of benefits when it comes, to taking your vitamins after surgery. So everyone, all of you should be taking an adult multivitamin. All of you should be taking a B complex. And your B complex must include B12, B1, B9, and folic acid. And all of you should be taking calcium. Calcium about 1,000 to 1,200 a day. And your calcium will have some vitamin D in it. So this is the minimum that everyone should be taking. But I do hope that all of you are being followed up at least once a year by your bariatric doctor. And they will do labs, blood work. And based on that, we may ask you to take more vitamins, or we may ask you to take less, depending on your lab level. Some of you may have to take iron, vitamin D, whatever it is. But just be aware of that. Very, very important to get regular blood work done after surgery and to take your vitamins. And all of you, please remember that surgery is only a tool. Healthy eating habits combined with exercise will be your key to long-term success. And that is my lecture for the day. And I will answer all questions once Dr. Watson covers his part. Okay, and I'll go ahead and put up the menu for you guys again once Dr. Watson is done. Okay, thank you.